Hello, this is Dr. Kevin Conners for another cancer Q&A where you can send us your questions and we will do our best to answer them. Again, if you are new to us, check out our website www.connersclinic.com or our YouTube channel. You can also download all of our books for free on there. I highly recommend that. Just updated our Lyme book and our cancer book. It's almost 600 pages. You can have it for a free download on a PDF. So highly recommend you do that if you have any loved ones or if you're dealing with cancer. Some good information in there as well. I'm here with Michelle Hamburger. She's another practitioner here at Conners Clinic. So we're going to jump into some questions that we have had sent in to us. And again, if you want to send in your questions, we'll get to them on maybe our next episode. So the first question, Michelle, how long does it take to get rid of cancer when you come here? That's a question we get a lot.
Yeah, we get that all the time. That's probably one of the top questions that we receive, especially as someone is getting ready to go home. They want to know how long is it going to take before they're better. And that's a tough question to answer. It's something that's answered within the Western medical system all the time because they tell you exactly how long it will be before the cancer is gone. They have a set number of years before they say that you're essentially cured. But that's not really a part of our foundational belief. We believe that a person never is completely rid of cancer. We all have cancer cells in our bodies at every point in time. It's just that for the majority of us who aren't dealing with cancer specifically, our immune system is taking on that burden and is able to keep that in check. For our cancer patients, that's a sign that there's immune dysregulation. So what is our ultimate goal? Our ultimate goal is to bring a patient into a state of remission. What does that mean to be in remission? It might mean that the cancer is either at such a low range that it's difficult to pick up on scans, or that it's just holding consistent stasis. It hasn't changed for a long period of time. It doesn't necessarily mean that the cancer is 100% gone from your body, but it means that overall your system is able to do what it needs to do to keep it in check and prevent it from growing out of control again. So our desire is to bring patients into a state of remission that 10 years from now they're in a better place than they were today. Our goal is not to give you a guarantee that you've completely eradicated cancer.
Well, and technically we don't treat cancer. So
Right.
legally only an oncologist can treat cancer using standard medicine. So we're not treating cancer, we're trying to help a patient that has a diagnosis of cancer be able to take care of it naturally.
Exactly.
And really to best understand this, to answer this question is to understand what cancer is. Cancer is cells that are in a state of rapid replication. Really, if we could just get your cells to stop replicating, you're winning the battle, right? Yep. And that's really what our goal is. It doesn't mean that the mass will go away. Mm-hmm. Why do we need it to go away? If we could just get it to stop replicating, that's the whole thing. So that would put a person in a state of remission as well. So, yeah. So it's not as much. We're not talking about how the other question we get. It's not on our list here, but we heard this several times today because there's some other clinics that are promising a percentage cure. Like we have 80% success rate. What's your success rate? First of all, for any alternative cancer clinic to even give that, I think is highly unethical, if not illegal.
Yep.
So we just don't do that. Matter of fact, again, go back to what you're saying. Our whole bottom line purpose is not to cure somebody of their cancer. It's to get their body to be able to fight this off and win the battle and stop the replication and slow things down. So another question we get a lot, one that came in to us here is, can I come to you? Or let's just make this generic. Can we do alternative care if we're also doing chemo or radiation or surgery? So if we're doing a standard care, can people still do alternative care?
Of course.
Well, and we've always said that, really alternative care should be your first thing you do, so we shouldn't be called alternative care, should we?
Natural. Or traditional.
Yeah, this should not be alternative. This
No.
should be this should be your main thing, that you change your
Yeah.
lifestyle, because that's what got you in the condition in the first place. Um, but I do know that a lot of people will say, "Oh, my oncologist said, don't do any supplements. If we're going to do chemo, don't do any supplements." And I just think that scorched earth position is so highly dangerous to
It
people.
draws such a hard line, and it tends to show more the lack of knowledge on the part of the oncologist to recognize that the majority of what we're offering is just plant-based solutions. So
Exactly.
it's really ignoring what nutrition is altogether. So a supplement is just a concentrated form of what
food.
you'd be consuming
Right.
anyway. And so why would you actually be stopping somebody from consuming the healthy foods and the healthy extracts from those foods that can support your immune system, or should have been supporting your immune system in the first place?
And we've addressed this question with chemotherapy. There are certain nutritional products that you wouldn't want to do with chemotherapy. Chemotherapy is a strong oxidizing agent,
Yep.
aka a poison. So you wouldn't do strong antioxidants, at least for 48 hours after you do the chemotherapy, because you don't want, if you're going to do chemo, you want the chemo to work. So you don't want to negate any of the effects of the chemotherapy. So any good alternative practitioner is going to be cognizant of that and make sure that you're not on a protocol that is going to negate the beneficial effects of the chemotherapy. So
Right. Well, really, I mean, I guess a big, to address that question is, though we may be a natural clinic, we consider ourselves integrative in our approach. The majority of patients who come to see us are either already doing Western medical treatments, or they're planning on pursuing them. So we're not a clinic that shuns somebody from working with us if they're choosing to also work with an oncologist and a traditional medical team. We encourage that.
Well, and we tell people we
Because
don't
it's
want people
wise.
to take a dogmatic position.
Right.
Either way, like, oh, I would never do alternative. I'm just going to do what my medical doctor says. I think that's foolishness. But I think it could be equally foolish to say, well, I would never do chemo. I'm only going to do an alternative approach. Sometimes you need to do chemo, you
Right.
know? So you have to have that balance, and that you're maybe you don't want to do chemo, but if you're doing everything from a natural perspective and your cancer is going the wrong way, sometimes it's the wise thing to do is to add another approach, and that can be hugely beneficial and turn a person around.
Yes.
And another thing you can remember, you don't have to necessarily follow through with 8 months of chemo, and you can pick and choose. You're an adult, you can pick and choose the level of care you want. So another question we have: how long is your program? Well, it never ends, does it? So our program does not have a end date to it. So, one of our taglines that I created on our website years ago is, once you're a patient at Conners Clinic, you're always a patient at Conners Clinic. And it's your choice. There isn't it's not a 3-month program and you're done, or a 2-month program and you're done. It's you start with us. You can always make appointments with us. We're always putting out new content like this. We're always adding blog posts. We're always writing more material. We're trying to make more videos. You can always contact us and make another appointment. It doesn't end.
Right.
We have a relationship with people,
Mhm.
not a program with people, and I think that's the difference.
Again, we don't have a cure date, period. We don't operate by that standard. We don't
5-year survival rate. or
Right, we
anything
don't
like
do
that.
that, where then once you've achieved X lab result, you're good to go and we don't need to hear from you again, or you just come in to do regular scanning. We believe that we're trying to implement a new lifestyle process that's going to make you healthier and healthier and healthier and maintain your system for the long haul. And so you're going to want to check back in with us. You don't need to be on the exact same supplement for the rest of your life. Your body will change and grow and adapt. And so we want to be able to have a growing relationship. Now, is that every single patient that stays in touch with us consistently for 20 years down the road? No. Go by what your body is telling you, what you feel is right for you, but just know that we are available for you, that we're not going to say, okay, you've been with us for 2 years, it's time to move on. We wouldn't do that.
Another question we get a lot is what makes us different than like the Mexico cancer clinics. I mean, most people, when they think of like, oh, are you going to do an alternative approach to cancer? You go to the Mexico cancer clinics, right? That's a common thought by a lot of people, and we never want to say anything negative about any other approach. But when we developed our approach here, it was based upon the belief system that, again, like we started this conversation, we always, all of us, even if we don't have a diagnosis of cancer, have cancer cells, meaning that cells go into rapid replication, and what makes the difference between whether I get a diagnosis of cancer and you don't is that whether my immune system is fighting it off and winning that battle, or it's too aggressive and takes charge and it continues to grow, and now it's big enough where a PET scan or a CT scan will pick it up, or I have symptoms that bring me into the doctor to get a diagnosis. So you're never really ever done caring for yourself and doing lifestyle changes to keep cancer at bay once you get into remission. So when we developed this program, comparing it to Mexico cancer clinics, first of all, I don't think you go to a place, regardless of where it is, and regardless if you do 10 hours a day of detox, and you're going to be cured of cancer in 3, 4, 5, 6 weeks.
No, physiologically speaking, that doesn't make sense.
No.
So it doesn't make any sense.
To go someplace and think that you're gonna go someplace for X amount of time and you're gonna be cured, I think you're going in it totally with the wrong mindset. I'm not saying that people haven't done that and their body has turned around and been able to fight off the cancer and they've lived for another 10 years. I'm just saying that that's just not our thought process. That's just not how we operate. I think it's more of a lifestyle thing that you need to do.
And that isn't necessarily what we've seen. We've seen it often happen that a patient will end up coming to us, or a prospective patient who will say that they've been to these different clinics for X period of time and their detox went really well and their cancer may have actually gone into some sort of remission-like state, but then when they left that clinic and they were no longer doing those intensive therapies day in and day out, their at-home life or their lifestyle at home didn't support that and the cancer came back. And so we've definitely seen that as a pattern, that it doesn't support that at the end of that time frame you're cured or the cancer's
gone. Well, that's
gone.
why when we use the rife, that people are going home with it. So people, you know, whether they're in our distance plan or they're coming here, they're using the rife at home for the rest of their life. Yeah. And then the treatment is at night so that they can live during the day and, you know, fulfill what God has them to fulfill during the day. So it's just a totally different philosophy, you could say, than thinking that you're going to go and do this heavy detox for a period of time and you're going to be cured and now you can just go back to your lifestyle. So not to knock any other clinic.
No, it doesn't mean that they're wrong.
No,
it doesn't mean that we're right. This isn't a wrong or right thing. It's just a different approach to, for us, we're looking really long term. What's going to take a person from here 20, 30 years from now?
And the other decision-making process that we had in how to put our program together is, honestly, I thought, well, what would I want to do?
Right.
You know, I am dealing with cancer. Would I want to go to Mexico for 3 weeks? Well, if that was going to be my solution, well, then I certainly would do that. But just thinking about the physiology of it, it didn't make sense that that would be an ultimate solution.
Right.
So when we put this program together, that was before I had cancer, I thought, well, I wouldn't want to do that. I would want to have a rife at home, and I'd want to use it while I sleep, if
Right.
that's possible, so I don't have to sit there and be consumed with my treatment during the day. And that leads to our philosophy of not making an idol out of your treatment as
Right.
well, so that you are spending your day doing what God wants you to do, and your treatment is, you got to sleep anyhow, you might as well get treated while you sleep, so you use the rife while you sleep. And that leads us to our next question. can I just buy my own rife machine at home and just do this on my own? And the honest answer is, yeah, you can.
Yeah.
You can. We've had people that say, well, I can't afford your program. What can I do? Well, at least get a rife machine. Get a good rife machine. So, and honestly, I have not been afraid to name names. There's only two that I've looked at. A number of rife machines, and when we first started taking care of people with cancer, we used a different rife machine than we use now. So there's only two that I would recommend, and that is they're the True Rife. I have no financial ties to these companies. The True Rife and the GB4000 are the only two that I would recommend. Now I know when I made recommendations before, people have put on the video, comments on the video, we use X machine. I've used this machine for the last 5 years. I've been really happy. Well, that's great. And one of the comments, I can't remember the machine that they mentioned, it was a machine that I've never tried. But I've played with about a dozen of the Rife machines out there, and about half of them I wouldn't even call Rife machines, because in my mind, for a Rife machine to be a Rife machine, it has to be using light frequencies, and then it has to have enough power to penetrate the body, or it's not doing anything.
Which light frequency was the original system that
That
Royal
Rife
Rife
found.
created. He
Yes.
used light frequency. So we've been wanting to stay along those lines of what his research led him to.
Yeah, and then you have to have it programmable, so that, because it's all about the frequency. So if you're not running the right frequencies, even if you're using a True Rife and you're running, strep frequencies on my prostate cancer, well, I ain't going to do anything to prostate cancer. So has to be programmed correctly. So if you feel comfortable doing it yourself and doing everything yourself, then by all means do it. We're not trying to make people dependent upon us.
No,
Well,
if
that's what
people can get a Rife in
Right.
their home, we love that. We love hearing
Yeah.
that people are pulling a Rife into their home. That's a great first step.
Yes.
So that we encourage that.
That's why we give away all our stuff for free.
Yeah.
All our books are a free download. All our videos. Subscribe to our YouTube channel. Get everything that we have and everything that we research and come up with. We try to get a blog post on it, get a video on it, to try to educate the public, because there's no possible way that we can see all the patients that call us on a daily basis. So we have to make decisions about who we can take as patients. So again, so that's all we're going to touch on today,
Okay.
I think. But go to our YouTube channel, go to our website, Conners Clinic, CONNERS clinic.com. You can download all of our books, our blogs, our videos. We got tons of content down there that will be helpful. And please send in your questions too. We'll get them on one of our next videos. Michelle? Thank you.
Bye. Thank you.